Thanks for tuning in to my latest presentation, The Benefits of Exercise Activity. My name is Rick. I'm an exercise physiologist and currently working in cardiac rehab for veteran population. This series will pertain to information, education, and exercise activity for those who have had a cardiac event. This video is mainly for clinicians, medical doctors, and staff to show how important cardiac rehab is in securing your patient's future. If you're already working in the exercise sports science field, then you already know the health benefits of regular exercise and what it does to help your body. In the elderly population, frailty is common, and wasting of the mind and body goes hand in hand. Cardiovascular and resistance training are beneficial for the heart, bones, muscles, ligaments, tendons, our mood, the vasculature, and improving hemodynamics. Many people don't realize the health benefits of regular exercise. So let's go over what exercise activity is. So what is cardiovascular activity? ACSM, American College of Sports Medicine, says that exercise is a rhythmic, continuous, and performed with large muscles of the body. The component of physiological fitness that relates to the ability of the circulatory and respiratory systems to supply oxygen during sustained physical activity. Common examples are like walking, jogging, cycling, swimming, hiking, stair climbing, rope jumping, cross-country skiing, skating, rowing. You get the idea. So cardio isn't the most glamorous exercise, but it is necessary and it can be fun. So performing with a friend so you two can walk and talk and lose track of time is great. Listen to music, a podcast, or an audiobook can make your cardio more enjoyable as well. And if you're on a cardio machine in a health club or in the comfort of your own home, then put on the TV. Watch a show or a movie and break up the boredom. A couple exercise recommendations, one from the ACSM and the other from the CDC, states that all healthy adults 18 to 65 should be participating in moderate intensity aerobic physical activity for at least a minimum of 30 minutes 5 days a week, or vigorous intensity aerobic activity for a minimum of 20 minutes 3 days a week. So what is moderate and vigorous activity? According to the ACSM and CDC, moderate and vigorous intensities. Moderate intensity is 3 to 6 METs, 3.5 to 7 kcals a minute. So something like walking to class, work, or to the store on a brisk pace at 3 to 4.5 miles an hour. Maybe bicycling 5 to 9 miles an hour, hiking, water aerobics, or yoga. Vigorous intensity is a little bit extra and just a little bit more effort. It's greater than 6 METs, more than 7 kcals per minute. Also speed walking 5 miles an hour or more. Jogging, running, backpacking, biking more than 10 miles an hour. Step aerobics, jump rope, singles tennis. So these are just a few examples of these two categories. Moderate is on the low side of physical activity, although it's better than being sedentary, and you get more benefit from vigorous intensity activity because you increase the effort and what you are putting into the exercise activity. Your heart rate intensity is based on a few parameters. First is your age, and the other is your resting heart rate. An individual in their 30s may have a moderate intensity heart rate that would equal a vigorous intensity for someone in their 60s. So to find yours and look it up, it's called the Kevorkian method or Kevorkian formula. I also have a video on the heart rate and RPE, or rate of perceived exertion, here if you would like to learn more. When you first start out your cardiac rehab program, you'll want to start off slow but be consistent. Your phase 2 may not reach the end of the moderate intensity heart rate scale, and that's okay. Slow progression is still progression. You'll eventually want to work up to at least 80% of your maximal heart rate. I'll put the link for this paper in the description below. Exercise is very important for your health, as shown in this peer-reviewed journal article. Cardiovascular disease is the leading cause of mortality worldwide and accounts for over 600,000 deaths each year. This piece of research goes over the benefits of frequent exercise and how it helps lower blood pressure, increase insulin sensitivity, lower LDL cholesterol, and raise HDL cholesterol profiles. Individuals who regularly participate in exercise have a lower resting heart rate, changes in tissue metabolism, and cell signaling. Although this paper references exercise, it only talks about the intensity of jogging, rowing, cycling, swimming, and endurance activities or cardio. There's no reference to any resistance training. I'll put the link for the description in this paper below as well. In this review article, Effects of Exercise to Improve Cardiovascular Health. In this review article, The Effects of Exercise to Improve Cardiovascular Health, the research shows that exercise combats the effects of obesity and its comorbidities. That includes cardiovascular disease. Other benefits include better mitochondrial function and the repair and strengthening of the vasculature throughout the body. It also ends up increasing the release of myokines. The review points out that overweight people are 2 times more likely to contract cardiovascular disease, and those with severe obesity are 10 times more likely than someone who is at a healthy weight. Lowering your risk is as easy as participating in regular physical activity, which will inevitably improve your overall health. Combined with being more mindful of what you put in your body through caloric reduction and better food choices, it will turn the tide of cardiovascular disease. So on the previous slide, you're probably wondering, what is a myokine? When you work out and exercise, you release myokines that help you preserve your muscle mass and your strength. That's why if you're sedentary and you start to age, you'll become more prone to muscle and bone wasting diseases. Myokines help protect you from losing muscle and aid in pancreas and endocrine regulation from tissues and organs, including adipose tissue, the liver, and the brain. Exercise is a very important part of the body's maintenance and function for promoting myokine release. You can also consider having the high effort of activities of daily living would elicit the similar response in the body as purposeful cardiovascular or resistance training. It is important to remember the more active you are, the more your body will want to preserve its tissues and become more resilient. It's when we are sedentary that our body starts to break down because it is preserving itself to function optimally. If you're not putting physical strain or stress on your body through regular exercise, there is no need for your body to keep those tissues metabolically active. Another component of good health is the incorporation of resistance training. In this paper, Resistance Exercise Training, its role in preservation of cardiovascular disease. In this paper, resistance exercise training and its role in the prevention of cardiovascular disease can be found on American Heart Association's journal website. By conducting purposeful resistance training exercises, the research shows a reduction in cardiovascular risk factors such as decreasing arterial stiffness and impaired endothelial function. Resistance exercise plays a role in glucose and triglyceride disposal and aids in the resting metabolic rate. More physiological improvements include lowering the risk of diabetes, hypertension, dyslipidemia, advanced aging, and obesity. Resistance training combats osteoporosis, sarcopenia, aids in the prevention of fractures from falls in older adults, and reduces the chances of frailty. In this paper, The Importance of Resistance Training for Patients After a Cardiac Event, the study highlights the benefits of resistance training to be as important as cardiovascular activity. Many physicians advise their patients not to lift over 5 or 10 pounds for several weeks after their surgery or cardiac event. All these remarks are doing is encouraging fear and activity, as the researcher notes. While these are based on old guidelines, they couldn't be farther away from the reality of what we go through every day. This table is from the same paper on the previous slide that shows that force required to perform activities of daily living. The doctor says you can't lift more than 5 pounds. Many activities in your normal life require much more than 5 pounds of force. Open a refrigerator door is 9 pounds of force. A car door can be 12 to 15 pounds of force. How about a full hamper of dirty clothes to wash? 21.5 pounds. If you're pushing a cart around the grocery store or lifting bags to put in the cart, those can be in excess of 20 pounds or more. How about a case or a gallon of water? You just had a cardiac event. That 5 or 10 pounds recommendation just went right out the window when you did go grocery shopping. By orally giving your patients a limitation, they will not feel empowered, and more often, you are adding to their hopelessness. Many doctors believe that performing exercise soon after their cardiac event may pose an issue like another cardiac event occurring, and that's just not true. In this paper, the results conclude that exercise is not only safe, but very effective. This ran a controlled trial, captured 12 non-strenuous events and 1 serious event in 383,096 patient hours across Japan, or 3.13 non-serious and 0.26 serious events per 100,000 patient hours. So not only can you perform regular exercise, but it's safe to do so under supervision of an exercise physiologist. Cardiac rehab exercises like cardiovascular and resistance activity is safe, effective, and a long-term solution for your patient's health. The combination of cardio and resistance training is better than just one or the other. The likelihood of having a cardiac event while exercising is very slim. Sedentary behavior led to your patient's cardiac event in the first place. So getting your patients back on their feet through an active lifestyle is beneficial for staying out of the hospital and living longer, happier lives. So thank you so much for watching. Throw up a like and subscribe. See you next time.